than the proposed dose for the human. When we give the monkey 100 times higher doses than those proposed for humans, there are no safety problems for as long as we look. You need that kind of safety data, and it has to be very firm to ethically justify moving forward to human clinical trials. So those studies were done, that data was obtained, it was safe as well as we could measure it, so we moved forward to human clinical trials. So again, now I'm going to tell you the results of the first human clinical trial of this growth factor gene therapy in Parkinson's disease. And the neurologist who headed this trial was Bill Marks at UCSF with his assistants Jill Ostrom there, neurosurgeons Phil Starr and Paul Larson at UCSF. A second University Medical Center also participated in the study, and that was at Rush Medical Center in Chicago with neurologist Leo Verhagen and the neurosurgeon Roy Baquet. And again, Ray Bardis at Serogene was involved in getting this done. And let's see. So again, this is small print. I don't know that you can see it from the back of the room, but this was what's called a phase 1 study. The real objective of the phase 1 study, of the first study in humans, is to determine whether one can deliver a novel compound or a novel therapy safely. But obviously one also measures efficacy outcomes. But the primary purpose of this was to see if we could do all of this safely in humans. So 12 patients were enrolled in this phase 1 study. And they were at what's called a Hone and Yahr stage of 3 to 4, which means they're more or less in the mid to late stages of the disease. And that means they're patients who have had Parkinson's disease for some period of time, usually 5 to 7 or 8 years. And they still respond to their Sinemet, to their L-DOPA medication, but the response is not nearly as good as they were earlier in the course of their disease. They're having more on-off fluctuations. Their control is clearly suboptimal. There were 2 doses of gene therapy that were given to these patients. 6 people were treated at a lower dose and 6 at a higher dose. And all of the patients, before undergoing this gene therapy with the growth factor, were on the best medical therapy that they could be given at the time. So the doses of their drugs were optimized. And the objective through the 1-year study period was not to alter the dose of their Parkinsonian drug. So we could really see what the effect of the growth factor was. And the first people were treated in June of 2005, so I'm going to give you the follow-up then on these 12 patients. And this shows you a diagram of how the gene therapy was done. This involves a surgical procedure to introduce the gene therapy into the brain. What's basically done is that a needle is passed through a small, what's called a burr hole on the scalp, and the needle is passed into the brain and deposited in a part of the brain called the striatum, where the connections from the degenerating cells find their targets. And 8 deposits are made on each side of the brain to deliver the gene therapy vector. And again, conceptually, what this will do is achieve effective doses of the growth factor and prevent the spread of the growth factor to broad areas of the brain, so that we get effective doses in the target and we don't allow the growth factor to spread beyond the target. And again, the complexity of the surgery to a neurosurgeon is not that difficult. This is simpler than deep brain stimulation, for example, which is commonly done as a neurosurgical procedure for Parkinson's disease. This is a single therapy, so people don't have to take other drugs related to this after the surgery is done. It's a single session, then you're done. So this is a summary of the 12 people who were enrolled in this phase 1 trial. The average age was 57 years. 3/4 of the people enrolled were men. These are some of the characteristics in terms of their severity, but again, they were at a mid to beginning later stage of the disease. And with regard to safety, sorry, this is small print, but the safety profile looked very good over 12 to 23 months of follow-up for these patients. Now, there were no significant adverse events. There were no severe side effects that occurred. Patients had some side effects related to the surgery itself, but they were temporary. There were things like headache and nausea. Once they got out a few days from surgery, they had no more side effects like that. So there were no serious adverse events related to the surgery, to the gene therapy itself that were persistent. So long-term delivery of the growth factor was well tolerated. Now, with regard to the efficacy, one can't say much about efficacy because we didn't have a placebo control group, but I'll show you the data that we have. And I'll summarize the data by saying that their primary So the way we measure efficacy in a clinical trial in Parkinson's disease is by measuring clinical parameters of neurological function. And one of those is called the UPDRS motor off scale. So this stands for the United Parkinson's Disease Rating Scale, and this has various components. The motor off looks at how well people are moving 12 hours from the last dose of their medication. So as many of you know, if you haven't had your medication for 12 hours, you tend to be rather slow and stiff. And we're using that as the primary outcome to see how well people do with the growth factor gene transfer. And overall, after 1 year of treatment and observation, patients showed a 36% improvement on this scale. So they were 36% better on the scale than 1 year earlier. And many other endpoints were looked at also and also showed some changes. I'll give you the caveats to interpreting that in a moment. But let me show you the data. So there were 2 dose cohorts, remember. 6 at a lower dose of gene therapy, 6 at a higher dose of gene therapy. And this shows the data from these 6 individual patients treated at the lower dose, and the red line is the average. These were their actual scores on this UPDRS motor off rating scale at the beginning of treatment and after 1 year. So here are 6 patients, 1, 2, 3, 4, 5, 6. 4 show improvement over this 1 year time period. 2 do not show much improvement over this 1 year time period. One of these we subsequently learned did not have Parkinson's disease. He had multisystem atrophy. So the multisystem atrophy patient did not respond. Of the 5 remaining patients with Parkinson's disease, 4 showed an improvement over 1 year and 1 did not. This is the and this is that same low dose cohort now looking at the percent that they changed from the baseline. So this is their baseline before undergoing this gene therapy. And this is their change at 3 months, 1 month, 3 months, 6 months, 9 months, and 12 months. So overall, the average of this group shows an improvement on the scale of about 36% over a 1 year time period. Again, the 2 non-responders are here. 1 did not have Parkinson's disease, and he wasn't harmed. And the other patient didn't show much benefit, but the other 4 showed this improvement. 1 patient, for example, 2 patients improved by more than 60%. This is the high dose cohort. So the patients who received the higher dose of the gene transfer, and again, you see their baseline scores and how those scores change over 1 year. And you see about the same effect we saw in the low dose cohort. There's about a 36 to 38% improvement overall over 1 year. These are their absolute scores on the scale, which clinicians like to see. These are the percent improvement over time. Normally on this UPDRS motor off score, patients worsen over time. So there's about a 10% worsening that you would see over time. And in contrast, these patients show significant improvement over time. And if we do statistics and compare how they're doing at the end compared to the beginning, these are highly statistically significant improvements as it turns out. But you shouldn't draw too many conclusions. This is, again, looking at the change over time then. This is the low-dose cohort. This is the high-dose cohort. And both show about the same overall magnitude of improvement over time. And this is the percent change, again, showing improvement. So there are other ways of measuring improvement in clinical trials in Parkinson's disease. One is called a clinical global impression of change scale. And on this scale, 9 of the 12 patients improved from baseline compared to the 1 year time point. 3 of the 12 were unchanged, and none of them worsened on this scale. And the natural history is to worsen a little bit on the scale. So this, again, looks good, but let me tell you about the caveats in a minute. This is another way of measuring how people are doing with Parkinson's disease. These are daily diaries that measure how many hours per day somebody is on that is able to move fluidly to have good motor function. And these are the baseline scores, and then the scores at 3, 6, 9, and 12 months. And the blue line is the low dose cohort, the lower dose 6 patients. Red is the higher dose 6 patients. And the black lines are the average of those 2. And you can see that there is a significant reduction in the amount of time that patients are off during the day. That is, the average time off went from about 5 hours per day to under 4 hours per day. The total hours per day when patients are on and able to respond to their medication improved from about 11 hours to about 13 hours. The time that they were on and had no disabling dyskinesias also improved. Again, for people who may be in mid to later stages of the disease, when you're on, you may have dyskinesias, excessive movement. You see this in Michael J. Fox, for example, in his public appearances, that Rush Limbaugh